Found in western New York and across the country. Good evening, everyone. The latest numbers from the state show the highest rate of infection in about 6 months. 652 people tested positive in western New York yesterday. That is the highest on record. The percentage of positive tests is the highest since mid-May. In Erie County, the positivity rate has now jumped over 8%. But as Nikki Demetri reports tonight, local leaders are still confident that we can slow the spread if we do the right thing.
We do need to continue to turn the tide before this spirals out of control. We do not like what we're seeing.
There are already more cases of COVID-19 in Erie County this week than all of last week.
We need to think about we, not me. Otherwise, there will be some ugly shutdowns coming forth.
Erie County Executive Mark Poloncarz says there's still hope, though, the numbers can turn around. If and only if, he says, people are responsible.
Remember, we did it once, we can do it again.
Erie County's top doctor, Dr. Gail Burstein, recommends isolation, quarantine testing, and practicing good health measures.
And this is how we break the chain of transmission, or else our rates are going to continue to escalate and exponentially.
Whether sick or waiting for COVID test results, Burstein says don't go to work or to school. Burstein says anyone who knows they were in close contact with a COVID positive case needs to stay at home for at least 14 days.
People just have to use common sense, be honest, just stay at home.
For those that test positive, Burstein says you should self-isolate for 10 days after you first get symptoms. If you don't have symptoms, isolate 10 days after you took the test.
We literally went from having low caseload to a crushing caseload in about a week and a half.
The dramatic rise in cases means county contact tracers are behind. Although Burstein says 10 more tracers started this week and more are expected next week, it's up to the community to take on some accountability.
Just because you have not been contacted by a contact tracer doesn't mean that you're safe. Doesn't mean that if you know you have a positive COVID test that you haven't been contacted by a contact tracer to be put in isolation. Doesn't mean that you can go out and go outside and do whatever you want.
Nikki Dementri, 7 Eyewitness News.